going to, there's an echo.
Is that on either side of the microphone?
Okay, good. Thank you. Thank you. There's going to be a lot of members coming and going. There's a lot of hearings this morning happening. We wanted to get this hearing in as well here in Harrisburg. If the members could, Representative Nelson, if you could lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Representative Wentling, if you could introduce yourself.
Sure. I'm Park Wentling, State Representative of the 7th Legislative District in Mercer County.
Representative Josh Kale, 15th Legislative District, Beaver, Washington Counties.
Representative Eric Nelson, Westmoreland County.
State Representative Robert Ledbetter, the 109th District, representing all of Columbia County.
Representative Barry Joswiak, parts of Berks County.
And there's Representative David Rowe. I'm not sure what number your county is, but 85th
Second place.
Legislative District, second place Legislative District. If you'd like to introduce yourself, Representative Rowe.
Yes, thank you very much, Mr. Chairman. David Rowe from the 85th Legislative District. That encompasses all of Snyder and parts of Union, Juniata, and Mifflin counties. Thank you, Mr. Chairman.
And we also have joining us online today Representative Joseph Ham. Representative Ham, thank you for being online. There will be members coming online, and Representative Torn Eckert, who is the vice chair of this committee, is also joining us right now. For those online, you know the drill. Raise your hand. If I don't recognize you, please text me so that you can ask your questions. Otherwise, make sure that you leave your microphone muted. Today is our third and final hearing on benefit integrity. For this particular series, I think the issues that have percolated throughout the series might merit a couple more hearings down the road at some point. But really what these hearings have been about and what they've shown us so far as legislators is that there is a way to do these types of programs, these benefits, in a manner that is so much more efficient and practical and common sense. And that efficiency is going to end up leading to billions of dollars in savings. And really, what this is about is ensuring that we have benefits for the people that need them, while at the same time being protective with the public fisc, because the public fisc is a public trust, and we need to make sure that we are protecting all of the resources that taxpayers send to Harrisburg. It's not our money, it's taxpayers' money, and we need to be ensuring that we are protecting those resources. So today, for this hearing, we have two testifiers. We have Nick Adelson, the Director of State Government Affairs, the Foundation for Government Accountability, and we have Roy Leonardson, the Director of State Government Affairs, the Foundation for Government Accountability. Gentlemen, I truly appreciate you all coming out to Harrisburg. I appreciate you coming around the state with us. The floor is yours, and whichever one of you would like to go first, go ahead. And if you could keep it 3 to 5 minutes, we'd like to keep it tight. I'm not going to gavel you out if you go over, but we like having a robust Q&A session and going from there. So, gentlemen, the floor is yours.
That's great. Thank you very much, Mr. Chairman. I'll be very brief before I turn it over to Nick, who will walk you through. I would just like to add one thing to what Representative Kale said. And, you know, when you talk about benefit integrity, what you're really talking about is benefit protection, right? You are protecting benefits for the truly needy here in the state of Pennsylvania, and we are delighted to be a part of that effort, because for us, we want to make sure that everybody who needs benefits or is entitled to benefits receives those benefits in a timely and efficient manner. But the culture that I hope that you're building and that I got from Williamsport and Punxsutawney was that we're really looking to have a state here in Pennsylvania that we celebrate people's first paycheck, not their first welfare check. And I really think that's what's behind benefits integrity here, is that acknowledgement that as a state, we can do more to make sure that folks get a hand up and get back into the workforce while making sure that those who can't work are protected. So I'll turn it over to Nick, and then we'll run through some things, and we look forward to speaking with you today. Thank you.
Morning. I'm Nick Adolphson. As Representative Kale said, the chairman said, from the Foundation for Government Accountability. Just a very, very brief bio for me as we get into the welfare space. I started my jobs kind of in politics working at the Department of Health and Human Services in the state of Maine as the legislative director for the commissioner there, and then for the governor, Governor LePage as his health policy advisor. So this is a lot of history here of stuff that I've had the opportunity to work on. Our presentation here says Sam Adolphson, the policy director. He was able to be at the last two. I am not Sam, unless you don't like what I say, and then you can call me Sam. All right. He is my first cousin, and we've had the opportunity to work together for a number of years. So let's jump to the first slide there. I want to start by just doing a very quick level set on what we're talking about. There are many welfare programs we could discuss. Each state has their own set of kind of unique programs, but there are a couple of very large ones that we're going to focus in on today. And I want you to understand just how large these are. And so I want to we're not going to go through every one of these rows, but Pennsylvania food stamp spending in the last 25 years has gone from $655 million to more than $4 billion. Now, most of that's federal money, but just so you understand the scope of the program we're dealing with. And then Medicaid in Pennsylvania in the last 25 years has gone from about $10 billion to $47 billion. About 16 to 17 of that is Pennsylvania general fund dollars. And so it's seen a significant increase in the last several years. And just by way of comparison, your population, it has increased, but not by as much as your Medicaid or your food stamp program. So those are the programs we're talking about today. I want to jump to the next slide here. So what is all this spending for? Why are you dumping such a significant amount of money into this program? Well, it's supposed to be for the truly needy. The number you see here is the number of folks on wait lists today with disabilities who are waiting for a certain set of Medicaid benefits. These folks are not getting the services they need. They are the folks that the program was created for. Let's jump to the next slide for me. Your governor seems to be giving this lip service, or is at least aware of it as a problem, but he's leaving out an important part of the story. You can want to help the truly needy all you want. You can want to take care of the elderly, but when fraud and waste is rampant, and when able-bodied adults have taken over your program, it's nothing left for the truly needy, let alone the taxpayers. So that's why we care about fraud, that's why we care about waste, and that's why you need provisions in your budgets, in your statute to deter, protect, and secure in your welfare programs. And I want to say right off the top, the best way to ultimately stop welfare fraud is to get people off welfare, get them into a job, get them out of poverty. There is no better way than to get them off the program and into self-sufficiency. Next slide. This isn't happening in Pennsylvania right now. As you can see, you've got the wrong kind of growth. You're not reducing poverty based on these numbers. It appears to be going up. The more you spend, the more people you add to the program, the more it goes up. And this is just enrollment, but I'm sure you all have a pretty good grasp on how this enrollment impacts your budget, and we saw that on the very first slide. Next slide, please. You actually have quite the distinction. You can click right through this. Just two more here. You have the highest total spending on Medicaid of any state in the budget, of any state in the country. 41% of Medicaid's, of Pennsylvania's all funds budget goes to Medicaid, the highest in the country. There are other states in the country like California and New York, Connecticut. None of those places are as high as Pennsylvania is today. And you can understand exactly what the impact is here. Medicaid is gobbling up more and more of your budget while you're trying to figure out how to fund public safety, schools, roads, and the truly needy, the 14,000 people on that slide earlier in the presentation. Jump to slide 7 for me, or the next slide. So you might hear maybe from a colleague or maybe some lobbyists in the building or a nonprofit CEO that this growth in the budget is actually okay because it's really helping the people who truly need it. What you see there on the slide is 4 categories. You're disabled, you're elderly, your children, and your able-bodied adults. Can you click through 4 times? We're going to put some numbers up there. I should have made you all guess, but I won't. 9% goes to the disabled. 18% are elderly. 30% or children. 43% are able-bodied adults. Let's go to the next slide. So 1.5 million able-bodied adults in the program, many of them without kids in the home. Many of them are men between the ages of 20 and 50. I haven't seen numbers for Pennsylvania, but for a couple other states where the largest category of able-bodied adults are single men between 20 and 40. That is not what the program was designed for or created for. Jump to the next slide. So what happens when your programs explode like this, full of able-bodied adults? Well, nothing. Nothing at all happens. Nobody goes to work. In fact, they're incentivized not to go to work. And what you see here is just an illustration of, as we've seen work participation rates, as we've seen welfare rates go up, we see work participation rates go down nationally. And of course, that's always the logical conclusion. When you give more away and allow people to not have to go to work, of course the work participation rates are going to go down. You want to talk about program integrity. A program meant for the truly needy is being used instead for able-bodied adults. And instead of freeing anybody from poverty, we're keeping them poor and stuck on the sidelines. So your governor can want to give more money to nursing homes, and he can want to do more for the disabled, but your money's tied up right now in 1.5 million able-bodied adults. Jump to the next slide. These are just some pictures from my hometown in Maine. They're all within like a mile of my house. Don't look at it as my hometown. This is really a picture of America today. We've made it easier to fill out a welfare application than it is to fill out a job application. And in fact, in the top middle picture there, with the McDonald's hiring sign, the building behind is the DHHS building. And that's where people are going rather than to apply for the job. Next slide. It's fraud, and it's by design. The Shapiro administration continues to work with the Biden administration to keep able-bodied adults on welfare from having to work. Can you click through on this one? So this is your waiver application in Pennsylvania. There is an existing work requirement in food stamps for able-bodied adults without dependents. States can request that it be waived based on certain economic conditions. Pennsylvania has requested that this work requirement be waived in all but 3 of your counties across the state. And so you can pay lip service to caring about work or caring about the truly needy, but then we apply for waivers that don't require able-bodied adults to go to work.
Can I just add to this important point, because it's 64 of the 67 counties. What you don't see in the rest of that memo is how they came up with the calculation to waive those work requirements. They used your unemployment numbers from December 2020, in the middle of COVID, to the following year. So they're artificially inflated. I just saw a memo that came out from your department that has the unemployment rates by market labor area. There's only one place in the entire state above 4. Most are in the high 2s, very low 3s right now. So if you look on that thing, this says it expires at the end of August. I would encourage you to strongly keep an eye on what type of letters and requests for waivers go to extend that another year when you have one of the lowest unemployment rates in the country. You're actually below the national average now. National average 3.9, you guys are down to 3.4 right now. So just to emphasize what Nick is saying, this is a part of this fraud by design. Everybody knows those numbers aren't right. CMS, the department, and DC, and this department approve those numbers. So, but this is a great example of an easy way to sort of protect benefit integrity.
Jump to the next slide for me. Yeah, and in that same vein, your governor has bragged recently about getting the improper payment rate down in Medicaid, because the 2022 improper payment rate was much, much lower than in 2019. There's more behind that story, right? A little like using unemployment rates from 2020 or 2021 to gauge whether or not you apply for a waiver. In the fraud by design vein here, in 2022, Pennsylvania had handcuffs on from the federal government. You weren't removing people from the program. And so there are, all across the country, there are artificially low improper payment rates for the first time because of the timing around when those were measured. And so you would expect Pennsylvania to be probably still closer to that 20% improper payment rate in Medicaid. And just so you have a sense, nationally, the improper payment rate is about 20%. It's $80 billion in fraud and waste. 87% of that is due to lack of documents and eligibility errors. 87% is because someone either wasn't thorough in the application or did not do their job. And that's $80 billion nationally. And I'm not going to do math off the top of my head here, but if Pennsylvania is close to 20%, that's a significant amount of your budget is improper, and it's improper because somebody wasn't doing their job or didn't fill out the application correctly. Jump to the next slide for me. So just very quickly, a few things. The fraud by design, it's always great to see yourself compared to other people, especially people like Ohio, right? You are slightly better than Ohio in this instance. There are probably a lot of other instances too. In particular, your state house is far more beautiful, but that's neither here nor there. Things like self-attestation rejected for residency. Do you know I can say where I live and the agency's just going to take my word for it? There is absolutely no check. Does it work that way even when you register to vote? Does it work that way when you register your car or when you go to the bank and open an account? Self-attestation is rejected here for age, so that's good. You got one of them. Self-attestation rejected for household composition. No, there again, would the IRS just take your word for it that your household had 5 people or 4 people? No, they require verification and documentation. We don't in our welfare programs here. Frequent death record checks or residency cross-checks. Every agency will say, oh, we do cross-checks. And they probably do, like once a year. But that's it. And so you can do those more frequently and get at data that's going to help you make sure you are actually paying for people who are eligible for the program. So jump to the next slide for me. And of course, there's more nefarious kinds of fraud, right? There's not just the improper or eligibility errors, there's legitimate fraud. These are both from Maine, from Sam and I's time at the Department of Health and Human Services. This is a halal market in Portland, Maine. They identified this as some potential fraud because they happened to be doing more business in their one cash register store than the largest grocery store, the largest Hannaford in the state, was doing down the road. And they noticed a lot of even dollar transactions. Ultimately, 2 brothers here, I believe Iraqi brothers, one of them went to prison, one of them was deported for $3.5 million in food stamp fraud over a period of 5 years, and then a significant amount of tax fraud as well. Those things are real. You have to look for them. You have to have a culture in your agencies that care about finding things like this, that care about quality. The next thing is just location data that we began to look at. Where are people spending their food stamp dollars? Anybody know where this is? Disney. It's not a short drive from the state of Maine, I can tell you that. You can look and see where your transaction data is happening. Is it happening in Pennsylvania, or is it largely happening in other states? We don't always do that. And of course, click through that slide for me. And of course, there's stories right here in Pennsylvania of some of this stuff happening. And you've got an inspector general who is looking at a lot of this information. So I'm going to very quickly, you can jump to that next slide. I'm going to very quickly run you through just a couple of things that you can do today, and then I'm going to turn it over to Roy and stop talking here. What can you do right now in Medicaid? And there's some things you as the legislature can do right now. You don't need federal permission technically to do these things. So you can have increased oversight over the waivers and the state plan amendments that are being asked for by your agency. Has anybody ever heard of a SPA? Not the kind you go to. It's a state plan amendment. Your agency, I would be willing to bet on almost daily basis, is submitting state plan amendments to the federal government to amend the Medicaid plan, to do different things, new things. Some of them are completely innocuous. Some of them are not. They will ask for waivers without your permission. You can have more oversight over that. You were elected to have that oversight. They were not. Stopping self-attestation. We talked about that a little bit. More robust data cross-checks, things like getting your hands around hospital presumptive eligibility, and we could get into more details on any of those if you all would like to. Next slide, please. And then as you look forward into 2025, there are some waivers that your agency should be asking for. Right now, they would get rejected. If things look different politically in the White House in 2025, these would be received in a very different way. So things like seeking, again, a Medicaid work requirement waiver, seeking waivers from some of the things in the program that don't allow you to manage it the way Pennsylvania should manage their program. And let's jump to that last welfare slide here. And then food stamp reform. I'm just going to touch one of them here. This is the most important, and you should do it today. The ABOD work requirement waiver that exists. We talked about it earlier. Roy focused in on it for a minute. You have almost 200,000 adults in this state on food stamps with no children in the home who are subject to this work requirement, who do not have to comply because the state is waiving it. You as the legislature can say, Governor, agency, you cannot apply for a waiver without asking for our permission first, and you should. That's in the purview of your oversight. There are other things there that are also really positive. I won't get into the weeds on any of them right now, but happy to chat more about them later. Roy?
Great. Okay, next slide. And actually, you can go to the next slide, too, and I'll just, that was for those guys. So here's the challenge. I'm going to talk about unemployment insurance very briefly here. There's three big things to think about as we're going through this. You have 450,000 open jobs right now in the state of Pennsylvania, which is amazing. You have fraud in the billions right now, and you have a culture of unemployment versus reemployment that exists not just here, but in many states around this country. Those are the three big things I want to talk about. So next slide, please. There's three specific solutions, right? We're going to talk about right-sizing the benefits. I'll explain that. We're going to talk about promoting work and then stopping fraud. Next slide. The first one I want to talk about is indexing benefits. Right now here in the state of Pennsylvania, you get 26 weeks of unemployment. That seems like a good idea when you have 12 to 15% unemployment or north of 10%. When you have counties here that have 2.1, 2.2, basically full employment, I'm not sure a half a year off is a good strategy for your workforce. So what states like Tennessee, North Carolina, South Carolina, Georgia, Florida, a number of states have done with 7, I think 6 additional ones in the past year have done is they've tied your unemployment benefit to the unemployment rate, right? So that's all they did. So they basically said, if this is the unemployment rate, this is the number of weeks. Some do a flat week of 12 weeks, some do 16, but every state has their own thing. This is important because it does 3 great things. Cuts the time in half people are on, spending went way down in your unemployment trust fund, and taxes went down hugely on your businesses. If you go to the next slide, I have some specifics for you, just for you guys to have and to look at. North Carolina's trust fund went up $5.7 billion. Kansas increased by 900% to $1 billion. Florida built up its trust fund to $3.9 billion. It was negative $2 billion. They were actually stealing from their general fund to prop up their unemployment system there. And in terms of people getting back to work, North Carolina and Florida cycle off the program nearly twice as quickly as an individual in a non-indexed state. Kansas was 4 weeks sooner. And then finally, the workforce, specifically the taxes on businesses. The North Carolina saw their employer taxes drop by 75%. Florida reduced unemployment rate taxes by 79%. Now, again, it's tied to unemployment. It's reasonable. It goes up when unemployment goes up, but it changes the way people look at their unemployment. So let's go to the next slide. There's been a culture of back to the fraud by design where within your unemployment system, there's a lot of looking the other way. I don't need to tell you guys this. You're knocking on doors. You're talking to businesses every day. Ghosting. Right? Folks are required to look for work. They say they went on a job interview. They don't show up for the job interview. I'm sure every business has talked to you about that. the employees are required to take a job. If they get a job offer of suitable employment in their area, they're refusing to go back to work, and they postpone that so they continue getting benefits. You're not allowed to do that. And then the other issue is work searches. Right now, I think Pennsylvania has 3 a week. Most states that are successful are moving to 4 or 5 work searches during the week. It's a 5-day work week. You could look for 1 job a day if you want to do that, or you could look for all 5 on Monday. We think that's another thing you can do. So these are small tweaks, but they change the culture. I just put this up here. This is back to the promoting work. South Carolina has decided that sending out unemployment checks as the duty of the unemployment office is not right. So they've changed the culture of that department. The department now is challenged with finding employment for folks. Yes, they issue their checks. It turns out that's computer electronic. It doesn't take a lot of people power. So now what the Department of Reemployment does in South Carolina is their job referral. They work with labor markets. Their job is to help people who are their unemployed folks get back to work. It's changing the culture. Next slide. The next one is just the program integrity. Pretty straightforward. It's very similar to the stuff that Nick mentioned. It's about cross-checking and, more important, verifying. So here's some very difficult questions that you could ask if you're in the department. Are you dead? You don't just ask that question, then you look at the death records. You verify. Hey, do you live in Pennsylvania? And they say yes, then you verify. So are you dead? Do you live here? Are you in prison? No. Okay, well, verify. So not complicated. All this data is readily available. It's available on national databases, particularly for the welfare, but for the unemployment, it's the same thing. And you have the new hires database. These are all available right now to this state. Now, I will say, the governor does some of these things. They're not codified. It's not in law. So whoever's in that office gets to determine sort of the standard that they will or will not apply. We believe that this is something that the legislature should have a say in. Next slide. This is just, I thought you might find interesting. I know you're knocking on doors all summer. I'm assured that some of you are hitting a couple thousand a week. Is that what you said, Representative Ledbetter? You were doing 2? Here's what you should know about what voters think about this. We do a lot of polling. I don't have a lot of things where I can say the lowest amount of support is 74% in favor. So I just put that in there so you have an understanding that you are in a safe space, to use the vernacular, if I can. When it comes to this issue and many of the issues that Nick talked about, it's all above water, all across the board. And I know you don't need me to tell you this. You talk to your voters every single day, but I thought you'd like to at least see it in black and white. So that's my talk on unemployment. Very quickly, I just want to mention RAINS. Next slide, please. Very simply, this is a regulations from the executive in need of scrutiny. And I like to call it new rules for the rules. So here's how it works. If a rule costs $1 million over 5 years, state legislators must approve that rule. It comes back to you. It's about the ultimate and accountability. So why does this matter? Think back to the pie chart that Nick showed you. 41% of your budget is in the welfare department. I can assure you that even more than 50% of your rules are being done in the department that spends 41% of your money. If you want to get control of your budget and the trajectory and spending in the long term, they need to come back to you to get the okay. This does 2 things. It reestablishes the fact that you are the accountability and oversight function in state government, you and only you, by the way. And it changes the department's attitude and energy towards creating new rules. How do we know this? Next slide. I thought I'd just give you a quick overview of what happened in Florida. 2,500 proposed rules on average per year in the state of Florida. RAINS was enacted. They're down to about 1,259, I believe, for the last year we have in 2022. Dramatically changed the excitement with which rules were pursued. It also changed the culture of the legislative committees. They spent more time on the legislation saying exactly what they wanted up front, and departments spent more time making sure that they knew what they're getting into before they said, yes, go ahead and pass it. So it is the ultimate in accountability. It's the way to reestablish that this is divided government, but the legislative branch is supreme. It is not equal branches of government. It is divided government. You have the ultimate say on everything. Everything. And that's what we've lost sight of, particularly in the era of COVID. So benefits and welfare, food stamps, the unemployment system, and RAINS are a great combination for all of you to consider. Really grateful to be here today. Happy to answer your questions. I'll defer all of them to Nick, and we can go from there. Thank you.
Thank you, gentlemen. Thank you. We were also joined by Leader Cutler, although he had to just go there. Representative Devanzo, Representative Gatos, Representative Cabell, Representative Schern, Representative McKenzie. Online, we have Chairwoman Pickett, Representative Marcel as well online. I don't think I missed anybody. Vice Chairman Eckert.
Thank you, Chairman. Yesterday, we held a press conference talking about how we need to return money to taxpayers and take it away from bureaucrats in Harrisburg. And some of the questions we got were, okay, House Republicans, Senate Republicans, you guys are looking to cut taxes. Where do we make up? And where's the spending cuts happen? I see this as a perfect opportunity, a perfect arena where we can talk about lowering taxes, but at the same time cutting government in commonsensical ways. How do you see that fitting in, and how have other states done just that by looking at these program integrity matters?
Yeah, good question. So with the welfare programs, you can, as you're making reforms, as you're passing things, whether it's in a budget or a statutory provision, you can essentially book savings, right? But I think the most important part of that, which is difficult when you're, in a 2-year legislative cycle sometimes, is this is the long game. Responsible governing is going to produce significant savings, but sometimes it takes a minute, right? It might not be one legislative cycle that you achieve the savings, but when you start to change how your agency operates, you're going to see significant savings. You're going to see people going back to work. In our experience in Maine, we actually pretty significantly shrunk the size of the Medicaid program, shrunk the size of the food stamp program, and it was not by making major eligibility changes. It was by governing it in a way that had real accountability. And so you can book savings right off the bat on any of these things that are going to get kind of a stronger grip on how your programs are operating, but it's really a long game, and you got to go into it kind of with eyes wide open, knowing that.
And I agree with you. I agree with what you're saying. But even looking at some of the recommendations you're making is simple things like a lot of the attestation stuff. I mean, that's going to immediately, I would think. Right. I mean, are you alive? Do you live in Pennsylvania? I mean, those two things alone, I think would be a culture change, and I would think see immediate savings.
Let me give you a specific story, Representative, I think that will support exactly what you're saying. Nick and I both also are in Ohio quite a bit, and we met with the auditor in Ohio. He did an audit of the Medicaid program, and he found 120,000 people in the state of Ohio that were enrolled in Medicaid in more than one state at a cost of over $1 billion years in a 3-year period. $1 billion, excuse me, billion years. $1 billion in a 3-year period. So the money is real. It's $1 billion in 3 years of state money and Medicaid fraud by not checking the rolls. So there's your example.
Yeah, thanks.
Representative Ledbetter.
Thank you, Mr. Chairman. Gentlemen, always great to see you. Thank you for coming to Harrisburg to testify this morning. Mr. Leonardson, we discussed a lot of these issues last week in previous policy hearings, and really alarming stuff. To Vice Chairman Eckert's remarks, not only is this an opportunity for us to save taxpayer dollars, but it's also an opportunity to ensure those revenues are going to where they belong. Just yesterday, I offered an amendment on the floor for an unrelated bill that was suggesting to provide a new grant program through insurance. And my amendment was very simple. You needed to be a resident of the Commonwealth and a citizen of the United States. But that was voted down. When we look at Pennsylvania and our union, Commonwealth, the states, every state has become a border state. The federal government has failed us when looking at the border and seeing what is happening with illegal immigration. So in that context, seeing the fraud that's being crafted by design and the opportunity to reinvent and close some of these gaps that you've revealed to us this morning, one thing that stands out in Pennsylvania is the amount of authority that the local levels of government have. Some of my colleagues were township supervisors. I certainly don't have the honor of holding an office such as that, but the authority at the local level is significant here. And I'd be curious, Mr. Adelson, Mr. Leonard, if you guys can expand on ways that we could enhance collaboration between the state and local levels of government to ensure that the benefit programs are effective in addressing these challenges while still preserving service within the needs that they're supposed to deliver on.
Yeah, so thank you, Representative, for the question. I think that's a big conversation. There are other states nearby to you. Ohio has kind of similar challenges. And to really get into the weeds on a solution, we'd have to spend a little more time than we're going to have today. But I think it's important to remember in these programs, especially the big ones, they are federal programs, right? We feel like Medicaid is, Pennsylvania's program. Everything that happens in Medicaid requires the permission of the federal government. There is a bureaucrat in Baltimore or in DC checking a box and saying, yes, what you're doing is okay. And so while that can be a problem for Pennsylvania, it also can provide the state with the umbrella it needs to provide very specific guidance to how your counties are operating as far as these programs go, as far as Medicaid and food stamps go. Now, as far as tying all your data systems together and using, that's probably a bigger conversation for another day. But I think you as a legislature and the agency here in Harrisburg has the opportunity to lay out exactly what they expect from a quality standpoint for all of those counties. Now, they might have to do some work to help the counties be able to comply or create the systems necessary, but they absolutely have that authority. So I'm not sure that answers your question. Certainly something I'm happy to dig into more for you.
Yeah, just to reiterate what Nick's saying, you have the authority here in Harrisburg to determine how the rules of the game are played locally when it comes to these programs. It's that simple. Politically speaking, if I were trying to get someone to change their behavior, I would also book incentives. And I would, in some places we have this example where, and it's allowed under federal law, if you find fraud and you discover fraud or you eliminate fraud or you eliminate sort of expenses and costs based on the new world order here from Harrisburg, you can keep a percentage of that back to help build your program within that program. So in other words, you're rewarding counties, townships for good behavior and for enforcing the rules and helping us tackle this problem. So there are options that you can build in with federal dollars and state dollars for incentives for local communities to do the right thing.
Clarifying expectations. That's good. Mr. Chairman, I think it's a good idea to start by ensuring able-bodied adults aren't on these programs. Thank you, gentlemen.
Representative Nelson.
Thank you, Mr. Chair. Great testimony, as always. I wanted to dig a little bit deeper in the waivers, the 64 of 67 counties right now. So you had mentioned that expires in August, and that would be that process. Do you know how many years we've had the work requirements waived in Pennsylvania?
I don't off the top of my head, Representative, but certainly something I can get for you.
Is that
At
driven?
least since COVID, and definitely in 21, 22, 23 through 24. So at least that long, 5 or 6 years.
So we were using 2020 numbers.
That's right.
In 2023 to, kind of help to manipulate that waiver process.
And the the administration would be working on their current waiver right now. I would make sure that the current numbers are reflected. I'm not, again, I think Nick spoke to this. I think Baltimore CMS is willing to check any box to continue the fraud. They don't care. So I think it's going to take a little bit of vigilance on your part to make sure that these waivers reflect the reality of the state.
And the 1.5 million able-bodied adults, they've been receiving benefits so long that they're off the unemployment.
Just food stamps.
Right, yeah,
Or
so.
just for food stamps.
Yeah, so the 1.5 that you see there, some of them are likely employed already, and they are not all subject to the work requirement. So who is subject to the work requirement is they are able-bodied adults without dependents. So it's going to be probably 200,000 of the total 1.5, which is still a real number, right? 200,000 is not a small number of folks. So that's the set of folks that would be required. As far as their status on unemployment or not, I don't know, but I would anticipate it's around 70% of folks on food stamps don't work at all. They have no reported income. And so I suspect most of them were not and are not on unemployment. I also would just say, we talk about fraud by design. The system that allows these waivers is exactly that. The state of New Hampshire has the lowest or the second lowest unemployment rate in the country. They have some counties waived. And they use the system in a way that essentially allows them to do it because they've manipulated it. The feds are okay with that. They're okay with it being manipulated in order to grant these waivers. And so without action by the legislature, it doesn't matter how good your economic situation is in Pennsylvania, the current administration is likely going to do whatever they can to approve a waiver from this work requirement. And so that's why, to me, it's less about fixing the application process, and it's more about saying, no, you can't do that unless you ask us first.
Great. Thank you. Thank you, Mr. Chair.
By the way, there's a very important caveat to all of this. Even with the work requirement, there are good cause exemptions. So if you happen to have some kind of health issues, of course, or a change in family status or something happened, there's a whole list of exemptions that people are still entitled to get if they can't work. So the department has a lot of leeway. The majority of folks need to go back to work, but there's still a long list of legitimate good cause exemptions that are available to the department to make sure that nobody is forced back into work that really just can't do it.
Yeah. And just one final follow-up, which I'm assuming is the case. The driver who is saying, yes, we're going to apply for this 64 out of 67 waivers, that's coming from the governor's office, or is that autonomy within the Human Services Secretary?
I mean, typically that is all in how the executive operates, right? So some governors want to have a really tight grasp, and they're going to say, anything that's going to the feds, I want to see it first. Most don't do that. Most often, it's just the agency saying, we're going to make this application, we're going to do it. But I cannot speak to how Governor Shapiro and his team would oversee something like that. He may see it before it goes.
Okay.
Ultimately,
Yeah.
though, it's a decision of the executive.
You shouldn't be surprised if your governor, like many governors in this country, have absolutely no idea that these waivers are being made. The system does not require that.
Okay. Thank you. Thank you, Mr. Chair.
All right. Any other Chairman Grove, thank you for joining us.
Uh-oh.
Thanks, guys. Now you're in the hot seat. So you
You want me to
hit.
swear him in for you? To get him under
Yes.
oath?
Then we can swear at him. Thank you, gentlemen. So you hit improper payment error rates of 20%. The problem with how the federal government covers that is they fail to realize that states are capitating and we're not doing fee for service. So that 20% is fee for service only. So they're not capturing potential improper payments made from MCOs, managed care organizations, to providers. Is there any work in Congress to correct that and try to update their modeling to reflect the new model states are doing?
I knew I wasn't going to have an answer when you started asking the question.
Right.
No, Representative, I don't know off the top of my head if there is any effort. What I know is Medicaid reform in the right direction has been a difficult conversation in Congress.
Right.
And every conversation in Congress is difficult,
Right.
right? But that in particular has been extremely difficult. I will go back to our federal team and just find out what kind of conversations there have been, and if it's something that we've pushed there, because I don't have an answer for you off the top of my head.
Yeah, because it seems like Congress is very interested in a bipartisan way to deal with improper payments. There's zero accountability coming down to the states on that, but it would update their modeling to reflect the reality of what's happening in Medicaid. And then I had a briefing with our hospital system, and I think so since 2014, it's a pivotal year, I think, in the state of Pennsylvania. So the past decade, we've had 28 hospital closures, and 40% of our hospitals are negative cash flow, basically. In 2014, we expanded Medicaid under Obamacare. Is that what you're seeing in every other state? Because the promise was, if you expand Medicaid, hospitals are going to be financially, it's going to be great. It's going to be great, right? It's going to be amazing. Money's going to flow. Are you seeing that same data in other states on kind of the failures of actual affordable health care out of that legislation?
We got a great study on that particular issue, Representative. It's actually even worse. States that did not expand Medicaid are faring better than states that expanded Medicaid when it comes to hospital closures and funding of hospitals. I'll actually email you a copy of the report. It just came out, I think, within the last month, a look state by state. So this shouldn't come as a surprise, right? Medicaid doesn't pay so well.
Right.
And it turns out private insurance pays twice, if not 3 times, depending on the service. And so when you shift hundreds of thousands, if not millions of people onto Medicaid in lieu of their private insurance, which they may have had, you create a problem. And just as a caveat, states that have not expanded Medicaid right now are eligible from 100 to 138% of the poverty rate to have a free private health care plan called the Silver Plan on the exchange that has no premiums and no out-of-pocket costs. So the dozen states that did not expand Medicaid, they're accessing private health care for their folks between 100 and 138, the population that you serve on Medicaid expansion,
Right.
and the federal government pays all of the costs. So it shows you sort of the shenanigans that are going on, but the bottom line is it's bad news for hospitals.
Right. So if I'm looking at hospital closures in rural Pennsylvania, urban Pennsylvania, suburban Pennsylvania, and I want to help their finances, the goal should actually be moving people off welfare rolls, off Medicaid and private health insurance to pay at cost. And that flips that financial problem we're having in these hospital systems without more government programs, without more government, actually less government spending.
Yeah.
And all we have to do is utilize and maximize our welfare to work programs in the Commonwealth and get people just simply private health insurance, right?
That's exactly right. And I like to have this phrase, Nick's heard it many times. I just fundamentally believe that work is a miracle cure for families, for schools, for hospitals, for health care, for dignity. Work is a miracle. Mm-hmm. It really is. And that's the issue, and that's what you're getting at, is that it changes everything for somebody. It really does. And that's getting back to that question. Are we having a war on poverty, or are we having a war on work? It looks like it's a war on work, and I'm not sure we can lose this war.
Right.
Because we are.
Yeah, thank you. Thank you, gentlemen. Thank you, Chairman, for holding these hearings. It's been, I think, invaluable discussing the impacts of government programs versus getting people to work in the private sector and making sure that we hold fraudsters accountable. So thank you, Chairman.
Thank you, Chairman Grove, for your leadership on this issue. You've been dealing with this not just for the last year, but for the last number of years, and it's much appreciated. Representative Schern.
Good morning, gentlemen. So, Mr. Leonardson, in the last hearing, I was able to call in at the very end, and Sam was able to capitalize on the main program that helped to get many folks off the welfare rolls. Having all your statistics and recommendations in front of me now at this time, and your suggestions for Pennsylvania to lower our welfare numbers, I was curious. in summarizing that program that worked, getting people out to volunteer or do community service, if they showed up, then, you know, perhaps they were able to stay on the welfare rolls. And when so many people didn't, you guys were able to make changes, make decisions that were very positive for the state of Maine. So my question is, in working in a bipartisan manner, at least to try to get results in a quicker period of time with our colleagues on the other side of the aisle, would you recommend a program such as that? In other words, they're not in the slides necessarily, but that kind of program where, hey, if you don't show, you don't do community service, you don't do volunteer work, you're off the list.
I'm going to let Nick answer that because he was the chief enforcement officer of that program, he and his cousin, Sam.
My cousin Sam was. So short answer, yes. And I apologize if Sam told this story and you heard it already, but one of my favorite stories from when we changed from a program that sort of existed and checked boxes to a program that actually held folks accountable to taking certain actions. So right after we started, this young woman showed up at one of the offices to check her box. She showed up in her sweats and looked like she just rolled out of bed. At lunchtime, she left. She came back to the office, dressed up, makeup on, ready to go. And the worker says, what happened? Why did you go back and change it? She said, oh, because I thought this was just going to be another normal government check the box, but you guys are actually serious about this. And it completely shifted for many, many people how they even thought about their interaction with state government. For so many folks, they're stuck in this, well, if I check this box and I check this box, I can get this and I can get that. And there's no path, there's no light at the end of the tunnel, there's no job at the end, and no help in staying in that job. And that's how it changed. So much of it was cultural, just this shift that, oh, they're taking this seriously and they're taking me seriously. We saw dramatic changes. Many folks just decided that's not worth it. The food stamp money is not worth the effort that I'm going to have to put in, so I'm out. But it made dramatic changes. And again, it's not always exactly the program. It's the agency has to shift culture. You can sign a new contract with some agency to do this, and if your contract language is not great and the agency doesn't do a good job, you're going to have the same outcomes you're having today, right? So it requires the agency to be engaged in real outcomes. But I think absolutely for a state like Pennsylvania, it's a great idea, a great direction to move.
I would just add, you know, it's about the moral high ground here. Somehow, recharging an EBT card automatically every month makes people think they have the moral high ground. That's criminal. The moral high ground is the frontline employee who sits down with someone, walks them through, helps them get back to work. That's the moral high ground. You can recharge their EBT card, but care. Like, be a real human and change the culture and actually help your fellow Pennsylvanian go back to work. And that's the culture that we're trying to change here, is this culture of work. And I think frontline employees want to do that. I just think that we have all moved into this zombie land of box checking. And this is what you get. Both sides just check boxes and move on. And the results are right. You're looking at it. It's not working. So I think we need to redefine the moral high ground here.
Point taken. And Nick, the final numbers, I just didn't know how long it took to go from 20,000, let's say, on the welfare rolls down to 1,500. What was the time frame?
There were about 15,000 of those dropped off within a few months. It was a few months where they just said, and again, for many of them, it was that food stamp recharge on my card is not worth the effort that I'm going to have to put in, which is all of your constituents' frustration with welfare, right? They want to help people who need it, but they don't want to help people who are just taking money with no accountability.
That's some pretty powerful statistics. Thank you.
I'm not sure exactly when he joined, but I noticed now that Mike Armanini is with us, Representative Armanini online. I wanted to make sure we mentioned that. All right, Representative Nelson, finish us off here.
Thank you.
All right, great. It kind of dovetailing on the representative's questions, it reminds me, under Governor Wolf, we passed a welfare to work program put it on his desk, and he vetoed it because he said it was demeaning to force people to have to do those things. I'd like to talk a little bit more about the indexing of benefits from unemployment. You know, as an employer, crazy frustrating if you're looking to hire even a professional who was laid off and they said, well, really, it's, you know, I'm going to wait until I'm at 20 weeks because we have kids and, you know, we can cash flow this. So can you touch on like a best practice state that has implemented indexing, and how many weeks does that flow? You know, how does that work? Because it was pretty interesting.
Yeah, sure, Representative, and I can get you a document that lays it out for every state. We believe the best standard is 12 weeks tied to the unemployment rate. So when the unemployment rate is 3%, 4%, there are 12 weeks of benefits, no questions asked. When it goes up to 5%, you add a week and you add another week, and you keep adding weeks up to 20 weeks total. We think that 5 months captures it. There's some states, and I think this is important, is cookie cutter legislation is not a good idea. Idaho and Pennsylvania are different. Florida is different than Pennsylvania. I think you need to make sure that you're in touch with whether it's your road industry, right? It's like some states, I think it's Iowa, was it 16 weeks? Iowa went with 16 weeks. Nick can explain why they did that. I think the big thing is that you're changing this notion that it is not a half a year off. It is an active work search investment with a limited amount of time to get you back into the workforce. So it goes from 12 weeks up to, I think, 18, and some ratchet it down slowly. They go 18, then 17, then 16 over time. So there's a lot of different ways to do it. Either tying it to the unemployment rate, or the other one's just it's 16 weeks, 14 weeks, 12 weeks, end of story. That's how much you get. So there's a bunch of different ways to do it. I think I will say that what we learned from North Carolina when they did it, it's a long education process for members. A lot of your members don't understand that this is completely a tax paid by businesses. Employees do not pay anything. This is an agreement between the employer, the employee, the federal government, and the state, but the businesses pay all of the taxes. And so that's just a fundamental difference. You're not entitled to it. It's a deal that businesses made with the government to help protect you in bad times. And so I would encourage you to spend as much time as is educating members just on the basics and understanding. And just to your other point, what's interesting is when you look at the 26 weeks window, most people go back to work between 21 and 23 weeks. When you lower it to 16, most people go back to work between 11 and 13 weeks. So it's interesting. You could probably give 2 years, and most people would stay 1 year and 11 months. So I think that it really is important to tying it to the economy, not to the number of weeks.
Yeah, great. Thank you. Thank you.
Well, gentlemen, I don't have any more questions today. I just want to say thank you. You know, there's a lot of interest within our caucus. I think as today's hearing showed, we had about 20 reps show up and ask questions, and many more wanted to, but there's other things happening. Throughout the course of this series, it's drawn a lot of reps from all over the state to understand these issues, because we do care about excellence in government. We care about a more efficient government. We also care about making sure that the programs that we fund are going towards what they're supposed to be going towards. It's that benefit integrity. If we're going to provide these benefits, we want to make sure that they're being directed to the places that they're supposed to go. And we'd like to see our governments be more efficient, especially here in Harrisburg. But you all have really given us tools to particularly dig in and make a change. It's one thing for us to talk rhetoric and to talk vaguely about reform and changing things and, you know, disrupting the status quo, but to actually have nuts and bolts of how we fix the system is invaluable. And for that, I just want to say thank you. I appreciate the work that you all are putting in and your organization is putting into this. There's going to be a lot more of this to come. There's already been a lot of work done. In fact, Chairman Grove was explaining to me the other day that there's a couple of these things we're going to work to get done now, not wait until next session. But there's things that we're going to do in the present. There's an agenda we're going to put together going forward. But there's a lot of work for us to do to make our government better, and you all highlighted it for us, and I very much appreciate that. So thank you for the work that you guys are doing. Moving forward, the Policy Committee meets next on Tuesday, June 11th, and it'll be the first in a series of 5 hearings. Correct? 5 hearings? Yeah. On historic tax cuts for all Pennsylvanians. Until then, this meeting's adjourned.